tell me bariatric surgery is the easy way out, here's what I actually see with my patients. Bariatric surgery is certainly not the easy way out. That's something that someone might tell a patient who doesn't know anything about bariatric surgery, or someone who's jealous of someone who's had surgery already. Bariatric surgery is a tool that can help people to help themselves to lose weight. Ultimately, people lose weight by changing their lifestyle. Changing your lifestyle means eating properly and exercising properly. Bariatric surgery gives patients a tool to help them to be satisfied with much less food, but the individual patient is responsible for actually eating properly and exercising. So when someone's successful with bariatric surgery, it's because they put in some work and did it themselves with the help of surgery. The biggest myth I hear about weight loss surgery is that the weight always comes back. Well, let me tell you what the data actually shows, and that's certainly not the case. The vast majority of patients who have bariatric surgery lose their weight and keep it off. In our hands, about 85% of our patients lose a significant amount of weight and keep it off long term. There's always going to be a small percentage of patients who return back to bad habits, but that's not because surgery didn't help them. It's because they decided to go back to bad habits. Anyone that has surgery and follows a proper protocol will lose their weight and keep it off permanently. Patients come to me thinking they'll be drinking protein shakes forever. That's not how this really works. Patients don't need to drink protein shakes ever before surgery, and they don't ever need them starting 4 to 6 weeks after surgery. Actually, 99.9% of people who drink protein shakes don't need them at all. It's way overused, and it's certainly not helpful to anyone, and it doesn't help anybody lose weight. The only reason we have patients on a protein shake for the first few weeks after surgery is to help to get them some nutrition. Do you have to drink protein shakes forever? Of course not. We definitely don't recommend that a patient drinks those prior to surgery, and after 6 weeks after surgery, we tell them to stop protein shakes for the rest of their life. All of your protein nutrition should come from a proper diet. There's a belief that you have to be 400 pounds to qualify for bariatric surgery, and that's simply wrong. The average person that has bariatric surgery is about 290 pounds, but we see people that qualify for surgery who might be 170 pounds depending on their height and their comorbid conditions, and there are people that qualify for surgery who are 500 pounds or even a little bit more depending on their height. But the average person we see is about 290 pounds. People think robotic surgery means a robot is doing the operation. Well, let me explain what's actually happening. There is no robot that's doing anyone's operation. Robotic surgery is the same as laparoscopic surgery. The difference is when a surgeon is using robotic arms, it allows a surgeon sometimes to use suture and the instruments and the stapler in a little bit different fashion. And in some surgeons' hands, this helps them to do a better operation. Other surgeons are more comfortable doing the operation themselves, laparoscopically or the traditional way. In general, laparoscopic surgery is quicker, it's less expensive, and the outcomes are at least as good, if not better, than when they're done robotically. That being said, robotic assisted surgery, which is what we're talking about here, is here to stay, and the technology will continue to improve, and more procedures will probably be done with the assistance of a robot over time. Everyone asks me if bariatric surgery is dangerous. Here's the honest answer about surgery and danger. The biggest danger that a morbidly obese patient has is being obese and not doing something to help them to lose weight and to become a healthier person. Someone that's severely obese who doesn't do anything to help their health problem has near 100% chance of ultimately having a complication related to their weight and their health. Someone that has bariatric surgery and loses weight drastically reduces their risk of having complications. So surgery itself can have risk, but we optimize our patients prior to surgery. Anesthesia helps us to optimize our patients, and the risk is very low in someone having bariatric surgery. I've heard patients say their doctor told them to just eat less and exercise more. Well, after doing this type of surgery for about 35 years, here's what I think about that advice. It's very easy for us to tell someone to simply eat less food, but that simply doesn't work for 99.9% of patients once they become severely obese. Once someone becomes a certain amount overweight, they need help. And that's what the medications and surgery are designed to do, is to help those patients who need help helping themselves.